come to the moment, literally, I think, that the world has been waiting for, the country has been waiting for. The world's largest vaccination drive will get set tomorrow, will take off tomorrow. Nearly 3 lakh people, individuals, are expected to be vaccinated at over 3,000 centers across various cities. Both vaccines, Covishield and Covaxin, will be given out in this first phase, and Prime Minister Narendra Modi is expected to kick off the vaccine drive tomorrow morning at 10:30 a.m. So what does this really signify? Why is this vaccination drive so important? And what are the challenges and hurdles we will face ahead? How do we ensure that this is a smooth process? Because remember, this vaccination drive succeeding is what will ensure a return to normal, a return for the economy, a return to jobs, to schools, and to business as usual to the extent we can hope for. So to speak on this, I'm joined today by Professor K. Srinath Reddy, President of PHFI. I'm joined by Dr. Arvinder Soin, Chairman of the Medanta Liver Institute, Dr. Anupam Sibal, a Group MD of Apollo Hospitals and a Senior Pediatrician at Apollo Hospitals, also joins us on the show. Welcome to all of you, and thank you so much for speaking with us today. Dr. Soin, I'm going to come to you first because I hear that you will be one of the frontline workers being vaccinated tomorrow.
Yes, so the moment we've all been waiting for has arrived. I got the all-important SMS telling me that I have to have my vaccination between 11 and 12 in the morning on Saturday. And yes, I'm looking forward to that honor of being one of the first ones to be vaccinated.
All right. Let me go across to Dr. Anupam Sibal. Dr. Sibal, tell me why it is very important that this first round of the vaccine drive goes through smoothly. We're attempting just 3 lakh people or thereabouts on day one. And then there will be a staggered approach 3 days of the week for this vaccination, and then the rest of the days for other vaccinations. What are the key factors and pressure points to look out for?
Thank you, Tamanna. I think that's a very important question that you raise. You know, when you are going to start a campaign which is as big as we are planning in India, and you know, when we say 30 crores in the first phase, people say, well, 30 crores, well, just to give you an idea of the size, it's just 3 crores less than the entire population of the United States and 3 crores more than the population of Indonesia, which is the 4th most populated country in the world. And after the 30 crores, we have another 100 crores. So I think it's extremely important that we get this right. And I think the approach of actually doing this the way it's being planned with 3,000 centers getting activated tomorrow and scaling up, I think is very logical. We have to test that the protocols that have been given out, and of course multiple dry runs have been done, and you know, several of our hospitals, Apollo Hospitals has hospitals in 16 states, several of our dry runs. In fact, we'll be vaccinating in 9 states, 12 hospitals on day one. So the dry runs have gone really well. The protocol's tight, but it's good to see it real time. As we get in patients, we register them, we see how COVID works. We observe them after the vaccination is over, and hopefully everything will go really well. We can't ignore the fact that we have huge amount of experience in India in managing very large scale events, like our elections are the largest in the world, and they go on and have over the years. So I think this will go well. It's been planned very well. I think it's been practiced, and tomorrow is the big day.
Tomorrow is the big day. Professor Reddy, what is important to look out for? Now, you know, I was just looking at the vaccine math, and as of now, the government has procured about 1.65 crore doses between Covaxin and Covishield altogether. One is not clear how many will be utilized on day one or how many have arrived really with the government. This is just the initial purchase order and procurement. Even if I account for, say, 10% of wastage, we have about 1.5 crore doses. That means around 75 lakh people can get vaccinated. There's a target of 30 crore people. So you need about 60 crore doses at the very least, more, again, accounting for wastage. How long will it take to ramp up production to that level and actually vaccinate such a large number of people?
Well, firstly, we are looking at 10 million people who are actually healthcare providers or the frontline health workers. And we are looking at another 20 million who are other essential service providers. they are the critical element initially. Then we have to look at protecting people who are, because of age and comorbidities, vulnerable to severe infection and possibly adverse outcomes. That is a total of about 270 million if you take the 50 plus age population, as well as the people with known comorbidities below the age of 50 years. So by the time the initial 30 million are protected, I think there will be a ramp up in the production of the current vaccines, which are already approved by the regulator. But plus, we are also likely to see other vaccines also making the grade. There are at least 5 which are currently now in various stages of clinical trials. And even if some of them make the grade by May, June, then we'll see the production go up further. And even the currently approved vaccines are also likely to ramp up their production. So if the initial stage is to cover these 30 crore people who are absolutely critical, 30 million people who are absolutely critical for ensuring the essentiality as well as the overall vulnerability being protected.
What is this whole drive going to look like is the big question. My colleague Utkarsh Chaturvedi has filed his ground report from Cooper Hospital in Mumbai, one of the 3006 vaccination sites where the vaccine drive will take place tomorrow. Take a look.
The mega vaccination drive across the country will begin tomorrow, and Cooper Hospital in Mumbai will be playing a very important role, as well as it will be vaccinating almost 500 persons daily in the center itself. There's a large screen which has been installed. As you can see, that preparations are going in full swing. The screen is there because once the vaccination drive starts, during the inauguration, the Prime Minister will be speaking to the beneficiaries as well as team members. Now, if you only speak about Cooper Hospital, there are 10 counters, vaccination will be given. It's a 3-step process. What we have been told is that 500 people daily will be vaccinated in Cooper Hospital itself. When you speak about the whole state of Maharashtra, almost 350 centers are there at this point of time. In Mumbai, there will be 9 centers. The amount of people who will be vaccinated, almost 7.9 lakh health workers will be vaccinated across Maharashtra in the first phase, 1.25 lakh in Mumbai. The amount of COVID shields which are available, 9.68 lakh COVID shields available in Maharashtra, 20,000 Covaxins. In Mumbai, 1.49 lakh COVID shields have been sent in the first phase. Now, the trial runs have happened once it happened across the country, but in Mumbai, there are 3 places where trial run happened today itself again, and everybody is now readying themselves. The final preparations are on for the mega vaccination drive starting tomorrow.
All right, so this is going to be exciting. Dr. Soin, we lost you earlier. You were about to tell us about, the fact that you're taking the vaccination tomorrow. Do you know what vaccine you are getting? Are you nervous at all as a medical practitioner, considering all the questions that are being raised about the vaccine, if there's enough data? People are going to be wondering if it's safe. What do you think?
Firstly, can you hear me now?
Yes, I can.
Okay. So the moment that everybody's been waiting for has arrived. And the SMS that I and everyone else has been waiting for arrived a couple of hours ago for me, telling me to have my vaccination between 11 and 12 in the morning on Saturday. So far from nervous, I'm excited. I'm honored to be actually one of the first few to get the vaccine. So I'm definitely looking forward to it. And I think that we should send a positive message about the vaccine across the country, because partial number of, partial population being covered is not going to do the trick. So people have to embrace the concept of taking the vaccination. And only when you take the vaccine in large numbers for, let's say, 50 or 60% of the population, eventually, are you actually going to get rid of the disease? So, the drive starts tomorrow, and I'm really hopeful the whole thing will go very well. I'm not nervous at all. I know that any jab for any vaccine will give you mild pain at the site. It might give me a little bit of fatigue, body ache, muscle ache for a day or so, but that's a small price to pay to protect oneself and the community against this infection.
Dr. Soin, just to follow up on that, because this really is the question people will be asking themselves. And informally, I've been speaking to a number of people because there is so much of speculation, news, uncertainty, and everyone's an expert now on vaccinations and vaccines and the science behind it. People are asking that if the COVID numbers are going down and I haven't got COVID-19 yet and everything seems fine, should I really take the risk of taking a vaccine? That is the question which comes forward most often. What would you answer to it?
So my answer to that question is very simple. Yes, a vaccine is definitely called for. In fact, you know, the recommendations are across the world that if you've had COVID infection before, and I believe at least two of us on this show have had it before, you should still go for the vaccination, because you don't know how long the protection of natural infection will last. In fact, you don't even know how long the protection of the vaccine is going to last. So I think that we have to vaccinate universally. That's definitely the truth. And that's how much we know at the point. Now, you did ask me the question of which vaccine I'm going to get. I don't know. I actually have faith in the system, faith in the DCGI. They've actually checked the effectiveness of the vaccines producing immunological response and being safe. So I'm going to go with whatever comes my way.
Professor Reddy, the purpose of the vaccine and the vaccination drive at a large level and a large number and scale is to provide herd immunity eventually to the larger community. What is the number required to achieve that? Is this 30 crore initial number going to be anywhere close to sufficient? And at this rate, when will we be at herd immunity? When will we be at the space where infections become close to negligible, very few, if any, people dying, and we can roam around without masks?
Well, nobody knows at the moment exactly what the threshold for herd immunity for this particular virus is. And even as we speak, the virus is changing form and behavior in terms of some mutations and infectious nature. So we really can't say it's going to be 50% or 60% or 70%. However, the purpose of the vaccines, first and foremost, is to prevent significant disease. It may not be able to prevent the transmissibility per se, and that's not been really tested in the trials. However, if people do not get significant clinical disease, they're also less likely to transmit because they're not coughing or sneezing. And therefore, ultimately, the vaccination will help to cut the transmission chain. But at what point it will happen, we cannot say. Therefore, the purpose is to first save lives, to protect people performing essential functions so that they're not sidelined, and to cut down the transmission over a period of time. Until that happens, we have to maintain our public health precautions and COVID-appropriate behavior. And by doing so, we'll ultimately get rid of the virus in terms of its threat. It may continue to live with us, but it will no longer be a major threat as it has been. So I think the vaccination is one major area of intervention, but other elements of our public health precautions must continue to support this initiative as well.
Dr. Sibal, what are the key factors to look out from here on? And do we know how long the immunity will last for this vaccine? I was having a conversation with Dr. Krishna Ayala of Bharat Biotech yesterday, and I asked him this question, that if I take the Covaxin, how long will it give me protection? And he said, I have data for 120 days. Is that the slight question mark over here? Because is it possible that people will start contracting coronavirus even after taking the vaccine few months down the line? Is that concern there at all in the back of the mind?
So, Tamanna, let's look at some high-level points here. Is there a vaccine any other vaccine for any other disease that's like 100%? The answer is no. I'm a pediatrician, so I've been vaccinating since I entered pediatrics at the age of 24, and I've seen the miracle of vaccination, what it does to save lives. I mean, look at polio. So we have to realize that the life cycle in developing a vaccine is 5 to 10 years. Now, look at the advancements in medical science that we have a vaccine that's being administered within about 10 months of the pandemic being declared. So obviously the kind of data that you have in 10 years, it's not possible to have real-time data in 10 months. What you can have is extrapolation, but you can't have that data. There's nothing you can do to fast-track data generation. So if you're looking at phase 4 trials, which of course will at some point in time start, that will only be when all the phase 3 trials finish. So to answer your question about how long will the immunity last, we don't know. We don't know how long the immunity lasts with a natural infection. And, the basis of any vaccination is to see that if you get a disease, then you don't get it again. Like if you got chickenpox, you don't get chickenpox again. Now with COVID, we don't know that. Well, of course, the chances of getting COVID again, if you recovered, are very, very small. So the data, like you just mentioned, 120 days. Well, we don't know if it's going to be 4 months, 6 months, 9 months, 1 year. Maybe even if your antibodies decrease, because there is memory in the immune system, should it get challenged with the virus, it will mount an immune response. Again, what kind of an immune response it will be, we don't know. But I think basically to summarize, this is a huge I think positive development. We now have a tool in our hand which we can take to large sections of the population quickly. But of course, this has to be dovetailed with social distancing, masking, and hand washing as we speak. As we learn more and we get to know how durable this immunity is, perhaps we will reach a stage where the other social distancing and so on is not so important. But at this point in time, and I think it's extremely important to highlight that, because there are a lot of people, a lot of parents who are asking me, of course, there is no pediatric vaccine licensed, and I don't think it'll be for a few months. Is that, once we've had this, life is going to be back to where it was in 2019, and the answer is no. One other point, Tamanna, I'd like to make here is that this degree of skepticism about taking a vaccine. Fortunately, in India, the anti-vaccine lobby is not as strong as it is in the West. But I think there should be no hesitancy. And I think the government's done a very wise thing by getting healthcare professionals to be the first. When senior doctors, nurses, technicians, everyone who's actually out there in the wards taking the vaccine, and they understand more about vaccination than people who've kind of got this knowledge over the last few months. If they are willing to take the vaccine, are really excited about it, well, that says something, doesn't it?
It's very interesting that you mentioned that, Dr. Sibal, because in several countries, the top politicians are the ones who've been at the forefront of receiving the vaccine. And I think you make a very important point when you say that the most trusted section of society, the healthcare professionals, taking the vaccine first will boost everyone's faith in its efficacy and its safety. And that's really an important point. So kudos to all of you for being those healthcare professionals that all of us can trust.